Organophosphate poisoning. Organophosphate poisoning is when your body reacts to organophosphate exposure. Organophosphates are a group of chemical compounds found in the following: 1. Pesticides. 2. Insecticides. 3. Herbicides. 4. Chemical warfare nerve agents. Organophosphates harm your body, damage nerves, and affect how your organs function. Short or long-term overexposure leads to respiratory failure and life-threatening outcomes. What types of organophosphates cause poisoning? The most common organophosphates that lead to poisoning include 1. Chlorpyrifos. 2. Diazenin. 3. Phentheon. 4. Malathion. 5. Parathion. In chemical warfare, the organophosphate sarin is commonly used. What are the symptoms of organophosphate poisoning? The symptoms of organophosphate poisoning affect different parts of your body and could include 1. Cardiovascular system. Increased or decreased heart rate, high or low blood pressure, abnormal heartbeat. 2. Central nervous system. A headache, restlessness, seizures, loss of consciousness, coma. 3. Eyes. Tearing up, bloodshot eyes, small or constricted pupils. 4. Gastrointestinal system. Abdominal pain, nausea and vomiting, diarrhea. 5. Genitourinary system. Peeing too often or less than usual. 6. Musculoskeletal system. Muscle weakness, muscle cramps, involuntary muscle movements. 7. Respiratory system. Runny nose, wheezing, shortness of breath, tight chest, breathing in more or less air than usual. Watery fluid with excessive mucus coming up from your lungs. 8. Skin. Excessive sweating. What causes organophosphate poisoning? Exposure to organophosphates causes organophosphate poisoning. These chemical compounds can enter your body through your mouth and nose or are absorbed into your skin. You're more at risk of exposure to organophosphates if you 1. Regularly work with or use pesticides, insecticides, or herbicides that contain the compounds. 2. Live in an area undergoing war or terrorism. 3. Ingest organophosphates to self-harm or attempt suicide. What does organophosphate do to the body? Your gastrointestinal tract, lungs, or skin absorb the organophosphates. Once inside your body, these chemicals stop or block the activity of cholinesterase enzymes in your plasma and red blood cells. A neurotransmitter called acetylcholine plays a critical role in muscle movement all over your body, and it usually transmits signals to cell junctions to make muscles move. After acetylcholine does its job, cholinesterase breaks down acetylcholine. Breaking down acetylcholine resets your nervous system to prevent overstimulation of your muscles and nerves. When acetylcholine doesn't break down, it collects in the area where nerve cells connect and communicate. This prevents your nervous system from communicating with the rest of your body, which leads to life-threatening symptoms. What are the complications of organophosphate poisoning? If left untreated, symptoms of organophosphate poisoning are deadly. Respiratory failure is the leading cause of death after organophosphate poisoning. Other complications can include 1. Cranial nerve palsy. To memory loss, sen myopathy. 4. Peripheral neuropathy, Wu, psychosis. Diagnosis. A healthcare provider often diagnoses organophosphate poisoning based on your symptoms. Clinical history and sometimes with blood tests to check the acetylcholinesterase activity levels. If you're exposed to chemicals or regularly use products that contain organophosphates, please let your provider know. Tests. Since there are many other medical conditions that can present with similar symptoms as organophosphate poisoning, your provider may order the following to check your overall health and to determine the cause of your symptoms. 1. Blood tests. 2. Urine tests. 3. Imaging tests. 6. Electroencephalogram. 5. Nerve conduction study. Management and treatment. Immediate treatment with atropine and pralidoxim treats organophosphate poisoning. Atropine reduces overstimulation of your nervous system. Pralidoxim is the antidote that reactivates the enzyme that breaks down acetylcholine. You'll receive these medications through an IV, Decontamination is an essential part of treatment. You'll need to remove all your clothing since it may contain trace amounts of organophosphates. Your care team will get rid of your clothing. Your providers will wash your skin thoroughly with soap and water at least 3 times to ensure the compounds are no longer on your skin. They'll also give you a clean hospital gown to wear for the rest of your stay in a hospital. If symptoms are severe and you have trouble breathing, you may need intubation to keep your airways open. How soon after treatment will I feel better? Depending on the extent of organophosphate poisoning, it could take several days to weeks before you feel better. Your provider will give you the best time estimate for your situation. Prognosis. It's possible to recover from organophosphate poisoning, but there's a risk that symptoms could come back, or you may have permanent damage to your nervous system as a result. Your outlook can vary based on the following. 1. The amount of organophosphate exposure. 2. The type of organophosphate compound. 3. How organophosphates entered your body. For your general health at the time of exposure. Prevention. You can't prevent all cases of organophosphate poisoning, especially if you're in an area that's undergoing war or you're not aware of organophosphate use. If you handle or work with potentially hazardous materials, you can reduce your risk by wearing personal protective equipment like gloves and a mask, for example. Remove any clothing or items that may have come into contact with the compounds before entering your home. Make sure you take a bath or shower after working with these products. And wash your hands thoroughly before eating or drinking. By Joshi Joseph.